objectifying a contraction of a pelvic floor by measurements of movement of the bladder base is an excellent way to monitor a patient's ability to contract as well as document their progress. So what I've done here is the patient's already contracted and relaxed, and I froze a screen. Now I'm going to use the scroll bar of the cine buffer, and I'm scrolling back and forth watching for their contraction. I look for the peak and the valley, and I'm using a horizontal marker, it's the distance marker, but I'm just using it as a placeholder to make a horizontal measurement. And I didn't like my first position. Now I go back and use the scroll bar again to mark the valley. I decided I didn't like that, so just try again. I'm going to then use the distance measurement. I could have made another horizontal mark there, but I didn't. Didn't like it. So that's really great. You can just clear it out. Now I'm pretty happy. So that ends up being 10.4 millimeters on the left-hand upper corner. You could see that. So I'm going to make a couple measurements. Now that was using the bladder base. There's another landmark, the vaginal stripe. And this is an excellent landmark on some patients. I really like it when you can reproduce it. In that case, I was started in the valley instead and then went to the peak. No guarantees, nothing that you have to do one way or another. We just don't have that data that says one's better than the other. So 10.6 millimeters. Guess I wasn't completely happy with that, so I'm going to try one more time, and I got 10.5. So I think there's pretty good consistency. So 10.4, 10.6, 10.5, that's not bad. And of course, you can always save that image. So that was what it looked like when I had already worked with the patient. Now let's go live, and you can see it again. I just asked my patient to do a couple contractions and relaxations. I'm making sure I have a nice picture of the bladder base and or the vaginal stripe. Stop her contraction. And then I'm going to scroll back and forth with the cine buffer. This time, same thing, bladder base. I started at the peak, go back down, find the valley, and I went too far. If you want to go frame by frame, you can use the arrow keys that are found on your tablet. 10.1 millimeters. I'm going to clear that, and using the cine buffer, the scroll bar, I'm going to go back and forth. This time do the vaginal stripe. Again, you don't have to do them all. I'm just doing this as a demonstration so you can understand the best way to make measurements. Don't try to catch the patient mid-contraction. Have them do 2 or 3 good contractions, observe the quality that you're looking for, and then make your objective measurements using the cine feature. You can go frame by frame with the arrow keys to really dial it in, but I generally use the scroll bar. The most important thing is to find a good, consistent, reproducible landmark. I've showed you 2 examples here, but of course this can be used anywhere in the body, and it's great to reproduce changes or to measure changes from session to session.